Understanding pH balance is crucial in managing acid-base imbalances. The normal pH range is 7.35 to 7.45. A pH below 7.35 indicates acidosis, while above 7.45 suggests alkalosis. The lungs and kidneys play key roles in maintaining this balance by regulating CO2 and HCO3 levels, respectively. Respiratory acidosis occurs due to hypoventilation or CO2 retention, often seen in conditions like COPD, pneumonia, or opioid overdose. This leads to increased acid levels. Symptoms include confusion, headache, drowsiness, and shallow breathing, requiring prompt intervention. Respiratory alkalosis is caused by hyperventilation due to anxiety, pain, or early sepsis. This results in excess CO2 loss, reducing acid levels. Symptoms include lightheadedness, tingling, dizziness, and tachycardia. Addressing the underlying cause is essential for management. Metabolic acidosis arises from excess acid, as seen in diabetic ketoacidosis or renal failure, or from loss of base, such as in severe diarrhea. It is characterized by low HCO3 or high acid levels. Symptoms include small breathing, hypotension, and confusion. Metabolic alkalosis results from the loss of acid, such as through vomiting or NG suction, or from excess base intake, like antacids. This condition involves acid loss or high HCO3 levels. Symptoms include shallow respirations, cramps, and confusion, requiring targeted treatment. Gastrointestinal symptoms can indicate specific acid-base imbalances. Vomiting leads to metabolic alkalosis due to acid loss, while diarrhea causes metabolic acidosis from bicarbonate loss. Alcoholism can result in ketoacidosis, and anxiety-induced hyperventilation may cause respiratory alkalosis. Arterial blood gas (ABG) analysis simplifies understanding acid-base status. A pH below 7.35 indicates acidity, while above 7.45 suggests alkalinity. CO2 reflects respiratory status, and HCO3 indicates metabolic status. Matching pH with CO2 or HCO3 helps identify the underlying cause. In ABG example 1, a pH of 7.30 indicates acidity, with high CO2 at 55 and normal HCO3 at 24. This pattern suggests respiratory acidosis, highlighting the importance of addressing respiratory function to restore balance. ABG example 2 shows a pH of 7.50, indicating alkalinity, with low CO2 at 30 and normal HCO3 at 24. This suggests respiratory alkalosis, often due to hyperventilation. Correcting the underlying cause is crucial for effective management. Key nursing interventions for acid-base imbalances include supporting airway and ventilation in respiratory acidosis, calming breathing in respiratory alkalosis, correcting causes in metabolic acidosis, and replacing electrolytes in metabolic alkalosis. Tailored interventions are essential for patient care. Compensation mechanisms involve the lungs, adjusting CO2 by changing breathing rates, and the kidneys adjusting HCO3 over time. Understanding partial versus full compensation is crucial for interpreting acid-base imbalances and guiding appropriate interventions. In COPD, chronic CO2 retention leads to respiratory acidosis. Nursing interventions focus on maintaining oxygen levels and encouraging pursed lip breathing to improve ventilation and reduce CO2 levels, thereby addressing the underlying imbalance. During an anxiety attack, hyperventilation can cause respiratory alkalosis. Nursing strategies include encouraging slow breathing and, if safe, using the paper bag technique to help retain CO2 and restore acid-base balance. In diabetic ketoacidosis, DKA, fat breakdown produces acidic ketones, leading to metabolic acidosis. Nursing care involves administering insulin, providing IV fluids, and monitoring potassium levels to manage the condition effectively. Persistent vomiting results in the loss of stomach acid, causing metabolic alkalosis. Nursing interventions include administering antiemetics and replacing fluids and electrolytes to restore balance and prevent complications. Electrolyte imbalances often accompany acid-base disorders. Metabolic acidosis can cause hyperkalemia, while metabolic alkalosis may lead to hypokalemia. Monitoring potassium levels is crucial in managing these imbalances effectively. The mnemonic ROAM helps in ABG interpretation. Respiratory opposite, where pH and CO2 move in opposite directions, and metabolic equal, where pH and HCO3 move in the same direction. This tool simplifies understanding of acid-base imbalances. Key points recap. Identify if the condition is acidic or basic via pH. Determine if it's respiratory or metabolic by assessing CO2 and HCO3. Link the causes to either lungs or kidneys and apply this knowledge to real clinical scenarios for effective management. The acid-base compensation diagram illustrates how the body compensates for imbalances. Respiratory acidosis involves high CO2 and low pH, while respiratory alkalosis shows low CO2 and high pH. Metabolic conditions involve HCO3 adjustments, highlighting the body's adaptive mechanisms. Compensation mechanisms are vital in managing acid-base imbalances. In respiratory acidosis, kidneys retain HCO3 to neutralize excess acid. In respiratory alkalosis, kidneys excrete HCO3. Metabolic conditions involve lung adjustments, showcasing the body's ability to restore balance.